Really excited to be here at ISPOR in Barcelona. The inclusion of caregiver qualities or care qualities in health economic modeling is really important lately. I saw a great session by extending that to include bereavement qualities. I'm really excited to see where the research goes from here and to contribute to it.
What's been fabulous about ISPOR conference this year has been all the talk about AI. We've seen some developments since ISPOR last year. There are nonetheless a lot of remaining concerns about safe AI use and how regulatory agencies and HTAs will accept work produced by AI. What would be great to see in the future is a lot more case use examples of successful use of AI and ideally cross-sector collaborations to make these stories be available with some practical guidance from regulatory bodies and HTAs to contribute as well.
I've actually spent my career supporting medical affairs, so this has been my first experience of ISPOR, and it's been a fantastic time to immerse myself in the data and the real key topics of interest, such as JCA. But what's been great has also been having conversations with people around how we can really make sure that these data are used strategically and communicated effectively, because they've got impact beyond your traditional payer and regulator audiences for other decision makers such as HCPs and patients. So excited to see how we can use these going forward.
One of the impressions I have looking at a lot of booths but also presentations, that people get more realistic about what machine learning, artificial intelligence can bring us. Not over-promising, not under-promising, getting more realistic. That's one take-home message for me from this ISPOR. The second one is that, and that's a bigger concern, is people are still confused about what joint clinical assessment is going to bring. The matter of the fact is that people are very focused on now doing it right, making it in time, but how it is going to be used in detail and whether or not that framework is appropriate, for example, for rare disease, is still under heavy debate, which is a little bit surprising with 2 months to go before the JCA is in effect. Final impression, HOR is still in search of their destiny. A lot of people are being reorganized in the pharmaceutical industry. A lot of companies are bringing HOR under medical affairs, and medical affairs doesn't know really what HOR can bring to them, and vice versa. Where I think the basic philosophy to bring them under one umbrella is a good one, because what is important is we take into account social diversity, that we take into account implementation science. HOR is more than just bringing something to NICE or supporting an AMNOG dossier.